Hey, this is Dr. Tom Rogers at Performance Medicine, bringing you the weekly Dictations every Monday. We try to send something out that will help you learn something about how to keep yourself healthy. This is the end of June. June is Men's Health Month, so for the whole month we've been talking about men's health. So this will kind of wrap it up. I want to kind of summarize it for you and talk about something that we need to clear up about myths about testosterone. Again, I hammer this because there's so much misinformation about testosterone. But anyway, to summarize men's health, men are much more likely to die or get almost any illness than women are. We die younger. We die of more frequently out of 9 of the 10 major causes of death in America. The only one that we don't die of more frequently is Alzheimer's disease. So in my practice, I focus a lot about men's health. I focus a lot about hormonal therapy, nutritional therapy, weight loss. I try to battle against the obesity epidemic in our country. And for example, more men are obese than women. Men commit suicide more frequently by 4 times. They're more alcoholics, more drug addicts. Of course, the incarceration rate's much higher for men. So, men need to pay attention to themselves. And when it comes to their health, they need to do things better than they're doing. So I make a push for men's health, and in the month of June is always a reminder. We talked about prostates, we talked about Cialis, we've talked about low T. I really want to clear up some of the myths about testosterone that are out there. There's a lot of myths about testosterone. Now, while testosterone is the major sex hormone in men, it is also the most metabolically abundantly active steroid in women. And that's a fact that is you can't deny that fact, and it's unknown to most men and women. So, one thing that I talk to about their men is how they treat women. Women are our bedrock, and we rely on women to kind of keep us going with our health. As a matter of fact, when men come to my office, it's most likely they've been pushed to do so by their wife or their girlfriend or their mom. So pay attention to women. And men should encourage their women, because women take care of the men and, for the most part, encourage them to get their testosterone checked just like men do. Women are more complex hormonally because they have 3 other hormones that they need to worry about more than men do. But the fact is that women need testosterone as bad as men do, just a lot lower dose. So one myth I want to clear up about women and testosterone is that testosterone does not cause breast cancer. I've had women come in that have been treated for breast cancer in my practice, and most of them are fed by estrogen and maybe even progesterone. So they have to avoid those hormones, but they do not need to avoid testosterone if they've had breast cancer. In fact, testosterone is very protective against breast cancer in women. And even if they've had it, it helps prevent recurrences of breast cancer in women. So, if you're a woman listening to this, or you're a man listening to this, encourage the women to come in and get that level checked, because it is the most metabolically active steroid in women and benefits them tremendously. Whenever I treat a woman with hormones, usually I treat with all the 4 hormones, but I think testosterone is the one that really makes them feel the best. So if the men are listening to this, encourage your woman to come in and get their levels checked. It's absolutely essential, as thousands of women that I treat will tell you. So, focusing back on the men, myths about testosterone. Testosterone causes prostate cancer. No, it prevents prostate cancer. You have to know what you're doing with testosterone, but it does not cause prostate cancer. The men I see with prostate cancer have low T, not high T. Think of when a man or a boy is 18, 25 or so, and they have extremely high levels of testosterone. Do they have prostate cancer? No. It's when men get older and have low T that causes prostate cancer. So another myth, testosterone makes men more aggressive. That's completely wrong. In fact, it calms them down. There's been many double placebo-controlled trials that have shown that it actually, even with extremely high doses of testosterone, it does not make them more aggressive or hostile. In fact, having a good high testosterone helps you sleep better, your joints ache less, you are calmer, you get more things done, and it's just a wonderful thing to have. And when it starts lowering, you'll feel the effects of it. So another myth, one propagated by a lot of doctors, is that testosterone can cause or worsen heart disease or strokes. That's entirely wrong. It does not cause heart disease. It prevents heart disease. Again, think of who gets heart disease. Older men with less T. Same thing with estrogen in women. Estrogen is very protective against heart disease. We know that for sure. And in fact, so is testosterone protective for women. So there's a lot of myths about testosterone therapy. Don't be scared of testosterone. Be scared to have low testosterone. And certainly, if you have been told that you have a normal testosterone, that's probably not an optimal testosterone level. Remember, you don't want normal, because what's normal on the bell curve in America is very low indeed. So you really want to think about getting your free testosterone checked. If your total testosterone's 500 or 600, which sounds good, but it's really not. It needs to be higher than that, 800, 900. And you need to look at the free testosterone. That's the part that's metabolically active. So it is protective in a lot of ways. Ways to replace testosterone, again, we've gone over them a lot of times. There's no real pill for it, although there is one that's coming out. I haven't used it yet, but probably won't. But in any event, there's creams. I'm not real fond of them. I don't think they work great. There's weekly shots that you can get, which are certainly effective. My favorite form is pellets. Whether it's a man or a woman, I think hormone therapy with pellets is by far the way to go. It takes me a couple minutes to get them in. Your levels are nice and smooth for 5 to 6 months without doing anything. I can even put an estrogen blocker in there if you tend to aromatize to estradiol. Usually I don't start out with pellets the first time on a man. Usually do shots and see where their levels are based on certain dosages, see if they're converting to estrogen, and if it's bumping up the hematocrit. But a lot less side effects on the pellets. And again, side effects are rare with testosterone therapy unless you don't know what you're doing. So I do encourage men and women that pellets are the best way to go. So come in and ask me about them. I probably do 6 cases a day on average of pellets. And so if you don't know about them, certainly you can ask. So I hope this has helped a lot of the men understand about men's health. We're trying to prevent heart disease in men, which is the number one killer of men or women. And we have a lot of ways of preventing heart disease. So, if you're a man and you're worried about your health, you're getting overweight, tired, low sex drive, ED, not sleeping well, you come in and talk to us about a complete workup. I'm not just here to say, yeah, you have low T, here's your testosterone. I'm looking way down the road. I'm looking 20 years ahead in what's going to happen to you. And hopefully I can give you some great advice, get you on a great nutritional pattern, the right vitamins, evaluate your hormones, replace them correctly, and help you live a longer, more healthy, active, abundant life. So it's been great, the month of June. We're getting ready for the month of July, and I've got some great things in store to talk about. So I hope this is informative. If you have questions, you can email us at performancemedicine.net. Or certainly come in to talk to us about any of this stuff. Thanks. I'll see you again next week.